Hi, my name is Brian Henninger, and this is my video on how to make a denture. So the first step is to have a patient. So this is our patient here. So the first step in making a denture is to take an impression of the edentulous site. This is just kind of an initial impression that doesn't have to be incredibly accurate, because we're going to go through a series of steps to make it a little bit better each time to get us a better fit. So we're basically just using a pretty standard alginate. You can mix it with water, spray down the adhesive tray, put the alginate in the adhesive tray, put it into the patient's mouth. So in here you want to take the cheeks, and you want to move them around. You want the patient open and close the mouth so you can get the muscles of mastification to kind of move the alginate around to where it's going to be. That's going to decrease any sore spots or rubbing that we have down the line. So after you get done taking your alginate impression, the next thing you're going to do is go and pour some stone casts. So you're going to take those impressions that we just made, and we're going to pour up a stone cast with it. And for that, you use type 3 stone, and then I already have this mounted with a type 2 model plaster. And basically this is just a impression of the edentulous arch. And it doesn't have to be incredibly accurate, because we're going to go through some steps to make each one a little bit better and a little bit better fitting as we go along. Okay, so with these stone molds, we're going to make a custom tray. And to do that, we're going to use this triad custom tray material and a little bit of petroleum. So we're going to take the petroleum, we're going to put it on the stone, and then we're going to melt it a little bit with a torch to make sure that it gets into all the pores of the stone, and that's going to help us from keeping the triad material from getting locked in. So then we're going to take the triad material, we're going to place it over the top of the custom tray. We're going to push it down so we get a nice tight fit, and then we're going to carve it back about 5 millimeters from the height of the vestibule. And this is done to reduce sore spots for patients, although it does reduce the retention of the denture slightly, but it's going to create a more comfortable fit. For the mandibular arch, we're only going to reduce it by about 2 millimeters from the base of the vestibule. So this is the triad curing machine. So after we get the fit that we want on our stone models of the triad material, we're going to take it over here, you put it in the machine, close the machine, and let it rotate one time with light. Pull it out, take the triad off the stone cast, and this is going to prevent it from locking in because it shrinks slightly when you cast it. And then we're going to put it back in and light cure it for another minute, and that's going to give us a solid base plate for which to take our custom impression. Okay, so the next step after we cure our base plate is we're going to take a adhesive on the custom tray and cover it in a thin layer, and we're going to let that sit for about 15 minutes before we put it into the patient's mouth. Okay, so now that we got our stone models poured up, we got our triad cured, and we got a solid base plate, we're going to start these steps for our final impression with our custom tray material. And for that, we're going to be using PVS. We're going to start with the heavy body, put that on to basically get a rough fill for everything, and then we're going to do multiple washes of this light body to make sure we get a nice smooth impression. We get all the palatal surfaces, the rugae. You really want to get the anatomy here. And so this is my triad tray that I already cut and cured. The blue from it is the adhesive that we put on there and waited for 15 minutes before we put it into the patient's mouth. You can see the green is the heavy body. And then I did a series of light body washes over the top of that. And basically we're just going to do, you're just going to coat the surface with a light body and then take it and then put it into the patient's mouth, wiggle the cheeks around, have them bite up and down, get the muscles to kind of force the alginate where you want it to go, so you get a nice record of the vestibule. You want to get a palate. You also want to develop your suction here. So you want to create a negative space on the palate surface where it's going to create a seal. It's like a suction cup. So you kind of do the light body around the outside, but not in the middle. So you don't fill that up completely. And this is going to be our final impression and custom tray. So we're also going to take a indelible ink, and we're going to mark the patient's vibrating line. And the vibrating line is the junction between the hard palate and the soft palate. So you're going to have the patient say, ah. You're going to look for movement between the hard palate and the soft palate. Our little model here doesn't have that. But you can see a vibration or a line. You're going to mark that with ink, and then you're going to reinsert the custom tray once it's solid to capture the ink. So you can see the ink line on that. And then you're going to actually trim the tray back to that ink line. So with this custom tray, we're going to make a master cast with type 3 or 4 stone. And we're also going to transfer the vibrating line to that cast. So I took here and I marked the edge. And then so what we would do is we'd use the box method, where we would create a box out of this custom tray, and we'd fill it up with stone and then let that cure. And then you're also going to drill a 0.5 millimeter line on the vibrating line to create a tighter posterior seal for that dental resin, the acrylic that's going to be the top of the denture, to lock in anatomically, and it creates a better seal and better function for the patient. Okay, so once we have our master cast poured up, once again we're going to make a base plate out of the triad custom tray material, and with this we're going to make the wax rims for the dentures. And what the wax rims are going to be kind of a representation of where we're going to put the teeth. In the final product, it's going to give us some clues into how the occlusion's looking. So to make these wax rim, once again, we're going to put Vaseline onto our master cast, melt it down, put the triad material on, push it down everywhere, trim it back 5 millimeters on the maxilla, 2 millimeters on the mandible, and then we're going to go through the same curing process I talked before. The next step is we're going to take wax sheets and wax rims, and we're going to melt these and lute these onto the base plate that we just made. So everyone's going to be different, but a good anatomical average is you want the base plate to be from the top to the top of the wax. These ones have the set that have the teeth set in it already, but imagine this being just solid wax. You want it to be 22 millimeters. And then for the mandible, from the bottom of the base plate to the top of your wax, where your occlusion is going to be, you want it to be 18 millimeters. For thickness, you want 6 millimeters. In the anterior, you want 8 millimeters posterior, and then you want to be 1 centimeter from the incisive papilla. You want to place the wax rim that you're creating over the ridge as well as you can. So in this phase of the denture making process is where we're going to go through the mesioaesthetics, which is something that us as the dentist can do. Most of the microaesthetics are going to be done by the lab. So we're going to put the wax rims in. And so the first thing that you want to do, and it's kind of tough with this being so low, is you want to get the patient at a reproducible eye level. You almost want to be looking eye to eye to them. Otherwise, when you're doing some of these measurements, a distorted view is going to cause them to be off. So let me adjust this here. Okay, so I got this about eye level for me in the chair. So the first thing that you're going to look for is you're going to look for the buccolingual position of the maxillary central incisors. And to do this, you're going to have the patient go into kind of a repose look, and you're going to get to the side. And what you want is you want the buccolingual extent to form kind of a waterfall that falls straight down the dentures. So after you get that, because you don't want them to be too far forward, you don't want them to be too far back, you're going to look at the incisal length of the maxillary central incisors and how much tooth they show. And this is kind of based on age. The older the patient, the less tooth they're going to show, just because gravity kind of pulls down the lip. So a younger patient is going to show a little bit more tooth in the repose phase, where an older patient might not show any. Their lip might be completely covering their teeth. We're also going to look at the maxillary occlusal plane, and to do this, you're going to line up the occlusal plane with the atraga line. We're going to look at the buccal corridor, and that is basically where your teeth curve around buccally and what you can see. And there's some anatomical landmarks on the face that we use, mainly from the median of the eye straight down. We're also going to look at the maxillary midline position. We're going to mark the maxillary midline angle, the zenith line, which is the point which your teeth stop here, the highest point of the apex. And for most people, that is just going to grace the lip when they're smiling. We're going to look at the buccolingual position of the mandibular central incisors, and we just want to position them kind of directly behind the maxillary incisors. And we have the incisal length of the mandibular central incisors. And with the incisal length, you only want a couple millimeters of that mandible showing. Okay, so once we've gone through our whole dress to the nine mesioaesthetics with our wax rim, the next thing we're going to do is we're going to have the patient in an alert feeding position. We're going to have him close, and then we're going to take a bite registration and mark the midline of the rims with a probe. And then the next step is to send this wax rim, master cast, and bite registration into the lab with a prescription for tooth shade and molds of tooth types. Men have larger, more rectangular teeth. Women tend to have a little bit smaller, rounded teeth. Okay, so once we get the dentures back from the lab, they're going to have teeth in them. We're going to do another try-in. This time we're just mainly looking for appearance, though. We can do some phonetics, but we're not really looking for any function with it, because the teeth, they're still wax. They're not actually real and hard yet. So you're going to go through problems if the teeth are too long, if they're too short. You may need to start over and completely do the whole wax rim. One of the biggest problems that you can have is if the midline is off. You can't just reposition all the teeth. You actually have to start over. So that's actually kind of a kill switch there. So once you do that second try-in with the patient, you're going to send them back to the lab, and then they're going to send you back the final dentures. And then you're going to do the denture delivery process, where we're going to put the dentures in. We're going to check for any sore spots in the patient. We're going to check for the posterior palatal seal. If it's not sealing, you can do a chair side realign here. This is where you would do that. You're going to check central occlusion with the bite paper. You check phonetics. One of the best phrases to say is "Sue is missing a piece," because that puts the S sound in different positions throughout the sentence. It makes you forces your tongue to to manipulate air different ways so you can hear for any improper phonetics that you're getting from the dentures. We're also going to go over patient education here, and that's one of the biggest important pieces of the denture process, because it's going to take some getting used to for the patient. They're not going to have the same functionality that they did before. They're going to understand that these can't be kept in all the time. They're not like teeth, and you can't treat them like teeth. You can't brush them with toothpaste because it's too abrasive. You need to take them out and clean them. You need to clean the gums underneath. Eating is going to be more difficult at first, and as you go along with your dentures, you're going to have facial remodeling that is going to require you to have the dentures come back in adjusted. The jawbone actually shrinks as you lose bone, and you're going to have to continually have the dentures realigned and potentially remade later on the line. You also want to schedule maintenance checkups with the patient at this point in time. You're going to make sure that they're not biting their cheek. You're going to review any phonetics, and then you're going to adjust sore spots and talk about maybe remedies for loose dentures like denture paste that they can use. This is also a good time to go over the patient with an acronym, kissing in a denture. The K stands for kin. Kin, like friends, will be available when needed, and you'll be available to the patient when they need help. The I stands for implants, and they make dentures better. Basically, they give a foundation for the dentures to bind on. You don't get as much bone loss. S, you talk about how it's going to be a little bit more challenging to be social. It's going to be harder to talk. The dentures are going to move. They're going to come out. People can be embarrassed by this. I is for involuntary gag reflex. This may be an issue, and this can be overcome by using implants to secure the denture. N is for nutrition. Patient will decrease in fiber, vitamin A, calcium. A is for adhesives. They make bad dentures better, but they're really just a Band-Aid. D is for disinfection. It's where you clean the teeth with a brush and soak them in a cleaner. E is for aesthetics. Teeth follow the ridges of the mouth, and not necessarily the ideal aesthetics. N is for new attachments. Denture abutments and the attachments will wear out and they need to be replaced. T is for teeter-totter. The bottom implant will rock up and down like a teeter-totter. U is for unnatural function. Teeth move, more so on the bottom without implants. R is for reabsorption, which I mentioned before. The jaws will keep shrinking, and that means the dentures will need more realigns. And then the last E is for endless sore spots. And because of the reabsorption, the dentures will continue to cause sore spots forever, essentially. So, hope you like the process of how to make a denture. Thanks.